Okay, so good afternoon to all of you. And Ila, are you ready?
Yes, ma'am.
Okay, so what is your topic?
Diabetic nephropathy.
Hmm. Acha, okay. You can start now. Okay, please turn on your video and then you can start. Are you going to show slides or chart
Yes,
paper?
ma'am.
Slides.
Right, ma'am.
Hmm.
Good afternoon, ma'am. Good afternoon, everyone. My name is Ila Sarabla, and I'm a second-year student from DDIT, and I'm going to give a presentation on the topic diabetic nephropathy. Ma'am, is the screen visible?
Yes, it
Hello,
is
ma'am.
visible. Yes, it's visible.
Okay, so now we will start with the topic. So does anyone of you had any idea what diabetic nephropathy is? Hello? Okay, we will start with the topic. So this is the kidney. So on the right hand side, we could see that this is the normal kidney. And on the left hand side, we could see that this is the diseased kidney. That means the infected kidney that has been affected from diabetic nephropathy. So about the definition, the diabetic nephropathy is also known as a diabetic kidney disease. I repeat, the diabetic nephropathy is also known as diabetic kidney disease. This is usually happens when the kidney are damaged from resulting from having high glucose level. You know, having high glucose, they may damage the part of the kidney that is used to filter the blood. And then these damaging part, these filter that are damaged, they becomes leaky, and then they let protein into the urine, which is known as proteinuria, in which we will go a little bit further later on. And then the term diabetic nephropathy, if we break this term into two words, it means nephro meaning kidney and pathy meaning the disease. Nephro meaning kidney and pathy meaning the disease. Diabetic nephropathy is is a chronic complication. That means it takes on a very long progression, and it causes secondary to diabetes. It is actually common, affects people to 20 to 40 percent of individuals with diabetes type 1 and type 2. So you may ask me, what is type 1 diabetes and type 2 diabetes? Type 1 diabetes is a condition in which the body does not make any insulin and therefore cannot control the amount of sugar in the blood. And type 2 diabetes is a condition in which the blood sugar is too high because the body does not produce or use insulin normally. So this is the mechanism of diabetic nephropathy, of how it actually started. So it started with an insulin deficiency. So we know that insulin is needed to move blood sugar, but then insulin specifically is known as the insulin deficiency is specifically known as the, or we can define as, it is the lack of insulin production. So because insulin is needed to move blood sugar. But then if these insulin producing cells are being damaged or destroyed, that means they are not being able to regain. And then they leave too much sugar in the blood and not enough in the cells for energy. And then when it leaves too much sugar in the blood, and then it leads into hyperglycemia, that is the high level of glucose. And from hyperglycemia, it leads into hypertension and then kidney dysfunction, where the kidneys are not being able to function properly. And from kidney dysfunction, it will lead to kidney failure, in which the kidney fail to functions. And this is a very severe, and it may arise complications like anemia, that is elevated rise of nitrogen, and metabolic acidosis, that is elevated levels of acids, and electrolytes imbalance. There will be imbalance in the salt containing like potassium, sodium, and then heart arrhythmias. Actually, this is arrhythmias A RRY, I made a mistake there. Heart arrhythmias means improper breathing. So before we dive into the mechanism of diabetic nephropathy, so let's first take the structure. Let's first take a look at the structure of the glomerulus. So what happens to the kidney in diabetes? Because we know that the main function of the kidney is to filter waste products from the bloodstream, and they can be excreted in the form of urine. So it is mainly carried out by the tubes, which is known as nephron. So inside the nephron, there are tiny tubules which are known as the glomerulus, as you could see in the picture, which acts as a filter. So in the definition, we could see that if these filtering units are being damaged, they let protein into the urine. So we could see that those green spots there, they are the proteins. So if these glomerulus are being damaged, it constrict, they are being damaged, then these glomerulus are not being able to functions properly, and it lets protein into the urine. Because having high glucose, it interferes with the functions of the glomerulus. These filtering units, they are being damaged and does not work properly. And then these proteins, which are there in this yellow portion, we can see this protein, it lets into the urine, that is a proteinuria. So this is the symptoms. Actually, at first, diabetic nephropathy usually has no symptoms, but then we could tell that there is protein in the urine after we have being detected with the urine test. But then usually and slowly and steadily, if the kidneys are being damaged, it is severe damage, then we can see symptoms such as weight loss and anorexia, that is a loss of appetite, and difficulty in concentration. A person would not be able to concentrate, need to pass urine, where a person had this feeling to pass urine more and more. The person would feel tired, his or her skin would be dry and itchy, and he or she would have nausea and vomiting and many more. So you can see in this picture, this is nausea and vomiting, this is ankle swelling, increased urination at night, high blood pressure, weakness and fatigue, persistent itching, and leg cramps and pale skin due to anemia. So risk factors. Some of the risk factors include hyperglycemia. Why hyperglycemia? Because this is due to the poorly uncontrolled level of sugar. That this is the main cause of or the main risk of diabetic nephropathy, and high blood pressure or hypertension, and high cholesterol level. That means there is a high level of fats in the body, a family history of diabetic and kidney disease, mainly the genetics that has been passed on. Being a smoker can be one of the main risk of diabetic nephropathy, because usually these smoking usually damage the vessels which is there. And retinopathy, this is a complications of diabetes that affects the eyes. It affects the retina of the eyes, that is in the back of the eyes. As you could see in the picture, there are some black spots or black dots that we could see in the eyeballs, is in the retina of the eyes. This is known as retinopathy, a complication of diabetes that affects the eyes. Because why this retinopathy occur? It occurs because of the uncontrollable and diagnosis. If a person is have to know whether the person have diabetic nephropathy or not, these are the tests that we could do. That is, a person should always do a regular checkup of the blood glucose level. That is, the blood glucose should always be checked regularly, and then the physical examination, that is the examination of the whole body, because they can detect if the person can have some complications of diabetes, and then urine test may be performed and blood tests. Some preventions, we should always make sure that the blood glucose is always controlled, and the blood pressure should always be in a normal range, that is in 120 by 80 mm of Hg. And if he is a smoker, he should stop smoking, or she should stop smoking, because if she or he smoke, it can increase the risk. and maintaining a healthy weight and control the blood cholesterol level. The weight should be maintaining, it should not be too obese. And some of the medicines that we could have in the treatment, usually we give this SGL2. SGL2 is a sodium glucose transport protein. This is usually give to person to control high blood sugar. And then angiotensin converting enzyme or ACE inhibitors may be given. Uh, this medicine is usually given to kidney patients, but then they are also given to have to treat high blood pressure, but other medical problems. And then in diabetes also they give, even if the blood pressure is normal, we can also give angiotensin converting enzyme. And angiotensin receptors blockers, this is usually given if there is any side effects that has been there by taking angiotensin converting enzyme. So these are the medicine that is SGL2, angiotensin converting enzyme, ACE inhibitors, or angiotensin receptors blockers, ARBs. So lifestyle to prevent ourselves, like to have a healthy lifestyle, to prevent ourselves from getting diabetic nephropathy, we should eat a healthy diet. A regular physical activity is most important to control our blood pressure, to control the cholesterol level which is there. And we should avoid a high protein diet, or we should consume less of uh, foods that is high in protein. And we should stop smoking. By stop smoking, this can be the best thing that we could do for your health, because smoking, it not only affects the vessels, but it affects the lungs. And also these are the lifestyle that we could do to prevent ourselves from getting diabetic nephropathy. So this is my presentation. Thank you, everyone. Thank you, ma'am. Ma'am?
Finish, Ila?
Yes, ma'am.
Okay. So you ask the group if they have any doubt regarding your topic. And for now, you just remove the share screen and you can ask them the questions if they have any doubt.
Does anyone of you have any doubts? Please share.
Can you show the symptom screen?
Huh? Pardon?
Symptom, common
Symptom?
symptom. Yes.
Wait. Here's the symptoms: weight loss, anorexia, difficulty in concentration, need to pass urine more and more, feeling tired, dry and itchy skin, nausea and vomiting. Is it done?
Done.
Does anyone of you have any more doubts?
Any more doubts, others? Say first if you have any doubt. Someone is texting in the chat box. You can just check it out once. Who is that? Ivajinia, you please write in English. What are you writing? Ivajinia? Okay, Ila, you can ask them the questions.
Okay, ma'am. Babok lang. Mabok lang
Yes,
ka,
Ila.
Tia.
Yes.
Can you tell me the definition of diabetic nephropathy?
Definition.
Yes, definition.
Sorry, Ila, I don't know.
Oh, okay. Then Darshana, you,
Yes.
Darshana.
Yes.
Okay. Diabetic nephropathy is also known as what?
Kidney disease.
Okay, diabetic kidney disease. Okay. Then, Virginia,
Yes, Ila.
what is the other name of nephro and what is the other name of pathy?
Nephro means kidney, pathy means diseases.
Okay, thank you.
Thank you.
Mm, Rifin Pale.
Yes. Yes.
Uh, do you know what is insulin deficiency?
Insulin deficiency is the lack of insulin production.
Okay, correct. Thank you. Surajit. Hello,
Yes,
Surajit.
Ilan.
Surajit,
Yes,
will there be proteinuria in diabetic nephropathy?
yes.
Okay, thank you.
Welcome.
Pinisha.
Yes, Ila.
Pinisha,
Yes, Ila.
what is retinopathy?
It is a complication of diabetes that affect the eyes.
Okay, thank you.
Welcome.
Mercy. Mercy,
Yes.
please tell me one risk factors
Risk
of diabetic
factor,
nephropathy. Yes, only one.
uh, high cholesterol level.
Okay, thank you.
Welcome.
Napishisha,
Yes.
can you name one medicine?
The angiotensin converting enzymes.
Okay, thank you.
Welcome.
Jamnunu,
Yes,
can you tell me any one symptoms of diabetic nephropathy?
blood pressure.
High blood pressure. Okay, thank you. Ma'am,
Yes, Ila finished?
ma'am.
Yes,
Yes,
Ila.
ma'am.
Okay, so I hope all
Yes,
of
ma'am.
you have understood regarding the topic and Ila have explained it very well. Okay, the slides and the diagrams, everything was very good. Okay, it was up to the mark. And regarding the participants, the group discussion was also good. You all were actively participating. So it should be in this way only. Okay, so as a whole, I will say it was a very good presentation. Okay, along with the diagrams also. So I hope the topic is clear to all of you. And if you have any doubt, you can ask to Ila because now she is the master of the topic, so she will be able to explain it quite well to all of you. Okay,
Thank you.
so okay. Tomorrow we have got the seminar. Not tomorrow, I guess Monday. Present or absent? Okay, I will see later on. You please give your attendance. to your respective CR, and then you can leave the group. You can leave the meeting, I mean to say. You can leave the meeting. Thank you.
Thank you, ma'am.
Mm.